answers. And I'm going to give a shout out to Dr. Gabriela Miranda, who happens to be a nutritionist. And she is actually been here online asking some questions. And she is a fierce promoter of carbs. So I believe that we used to collaborate together. She's now gone on to work at a different place. So I'm going to do the most, uh, let's say, exciting invitation to get her on this podcast and debate a little bit about carbs, about what she believes that carbs are supposed to be doing with our body. And I'd like to give her a little bit of let's say, debate on the topic. It would be a great show. In fact, I'm having Gloria Miranda, our producer, trying to reach her right now so she can zoom in to this podcast. Hopefully, she will. But in the meantime, I see a lot of patients tuned in to our past podcasts and a lot of COVID 19 questions. So, one of the COVID 19 questions that were asked was about symptoms, and they're asking, what are the symptoms of COVID 19, and are they, can you distinguish them from asthma? COVID 19, the more we see, the more we learn. And there's a few factors that are happening with understanding how COVID 19 works, the inner workings of a virus that is completely new to us and new to our body, new to our immune system. COVID 19 spreads aggressively, as you've seen, but it also spreads very stealthily, if that's a word. It is sneaky because what it causes is a very big gamma between no symptoms whatsoever to very aggressive symptoms, and as you already know, in a certain subset of patients, death. Um, and it somewhat depends on the patient's immune system, but not all the time. You know that if you have metabolic disease, which is a lot of us in the United States, either because you have excess weight. Let me put it to you this way: 2019 study, 2017 study looked at years of population in the United States and between 2009 2016, and they measured people, and they measured the things that are important. They measured waist circumference, they measured blood pressure, blood sugar, blood cholesterol, blood triglycerides, and they looked at all these things, and those are called biomarkers, markers, measurements, let's call them, from people that indicate health or disease. And they found that 12.2% of the US population is metabolically fit, which means that 88% of the US population, 88% have one of these markers or several of these markers. These markers are markers for disease, metabolic disease. So if you're staying at home and you're not selecting the best options food wise, and you're not in a physical activity regimen, exercise to be exact, there's more probability than in the next couple of weeks that your blood sugars are going to increase and your insulin is going to increase, and you're going to have a fatty liver, or you're going to create a fatty liver. You know, a fatty liver can disappear in days. We, in fact, have proven it in weeks, but there's several studies that say in days. So the same thing can happen in the reverse path or direction. You can actually create a fatty liver in days. And it all has to do with carbohydrate consumption, especially the way that agro industry and food industry feeds us. So going back to the question about metabolic disease, is the more metabolic disease you have, the higher the probability you're going to have severe reaction and less than ideal results. Having said that, this virus is so stealthy that a good percentage of population is going to be asymptomatic. What is the percent? It's been said between 20 and 60%. Where is this information coming from? China. Why? Because they're the only ones that have gone through it completely and ended the cycles, more or less. And they're the ones that had the testing. What do we have to do to understand what the COVID 19 complete description of the disease is? Well, first, we have to understand, we have to do a mass testing to understand how much percentage of those patients were asymptomatic. A lot of people can get it, they can be positive and completely asymptomatic. The more numbers that have had it asymptomatically, we don't know. We don't. The only way to know is by testing. You can't ask them, "Do you think you've had it?" No, because they are asymptomatic. The only way to really know what the death percent is and what the intubation and ICU critical care percentages is by knowing the total number of infected people. That's why testing is important. That could probably put our mind at ease. The other thing that's important is that now that we've described that there's a huge gamma from asymptomatic to people that have mild symptoms, they're usually going to be cold symptoms, respiratory symptoms. Not all the time. Some are going to have severe symptoms, and some are going to have gastrointestinal symptoms like pain, like diarrhea. Some other symptoms are rare nausea, vomiting, but they're still there. So there's a lot of confusion still uh, of what symptoms were associated to something else and which symptoms were associated to COVID-19. But we're getting there. And to answer the question, asthma, wheezing, difficulty breathing that comes in attacks is very different from the virus disease itself, because COVID 19, what it will do, it will cause upper respiratory symptoms. And as it progresses, the respiratory distress increases. Usually it's in 1 week progression, and then the second week it can get better or it can get gravely worse. And that's where you see, if you've had COVID 19 for 7 days, the next week, it's a 2 week phase. Usually the second week is when you're going to see the increment of symptoms, and that's where it can get ugly. That's when the oxygen saturation starts diminishing, and that's where the transport of oxygen from the lungs into the lungs and from the lungs into the blood gets distressed. So to answer the question, they're completely different. Asthmatics, though, should be under control completely, because asthma itself can predispose to a more aggressive COVID 19, it would seem on some commentaries in the scientific world. Now, going to the next questions, what are doctors saying about people on ventilators is the worst thing to do? They need blood. What are doctors doing? All right, so that's a very valid question, but because what we're seeing is that this virus really is attacking the immune system, and it's overexciting the immune system. And it seems that what is creating all the damage is inflammation due to an overexcited, overzealous, overactive immune system. That's what the cytokine storm is all about. Cytokines are nothing more than antibodies that are released specifically by certain white blood cells, and that they have certain uh, duties when they are secreted. They have a specific defense and to activate other factors for your immunity, et cetera, et cetera. But these factors are supposed to go and be secreted and then attack the virus, but sometimes they can attack your own body. That's what an autoimmune disease could be described as. In this case, we believe that there's the virus is actually attacking the transport system of the red blood cell. And this is why you see during the second phase, the first phase, like we said, is 1 week, when you start seeing a second phase where oxygen transport is being affected. And obviously, the lungs are responding to a aggressive inflammatory process, but you still need the lungs to pass the oxygen you breathe in to the red blood cell, which is the one that transports it. So it's a difficult situation where the ventilation is not to cure the disease. It's basically to prevent the person from asphyxiating without oxygen, because the transport system on the one hand is affected by the virus, but on the other hand, it's the lungs that are actually just inundated with inflammation and liquid and effusions that make it so difficult for that oxygen to come in. That's why, but it would seem that the ventilators themselves are causing very aggressive damage on the lungs. And in fact, those that actually survive the ventilation period are extremely, extremely weak, and their pulmonary function is very damaged. So you see athletes that recover and they can barely walk across the room. So that's what we're seeing right now with COVID-19. We hope that in the near future, we're going to have a deeper understanding of what's going on and probably try to block that attack before it actually happens, when the genetic material from the virus attacks the cells in the body. Um, Somebody was asking, no, before that, I'm going to say something about cremation. There you go. And it says, as a doctor, can you tell me if COVID-19 virus can continue to live once buried in the ground, or should they be using cremation? Viruses don't want to kill the host. Uh, their idea is to be able to use the host, the whole system, to replicate themselves. So it's in their worst interest to kill the host. So of course, once the host dies, a virus can't survive. And that's why the cremation thing isn't really, it's not going to survive past some hours, maybe even a little bit more, depending if the liquid is there, but ultimately it's going to perish. That's why these rules about the virus, just be wary about cardboard 24 hours, plastics 72 hours, metals can vary between 24 and up to 7 days, depending on what type of metal. So just be wary of your environment right now still, while there is no vaccination or no antibody available or treatment. The best thing we can do is keep away from the virus by social distancing, keep away from the virus by everybody wearing masks, and wash your hands. You know the whole drill. I think we've all learned it. Now, hydroxychloroquine is a question. The next question: should people be buying it to have on hand? No, no, don't buy it, because first of all, it's going to be difficult for you to find it. Everybody already who had the ability to buy it bought it, and now there's rationing going on because, well, so all the stores are being redirected to concentrate them on clinical trials that are ongoing right now. It seems to work. Everything is tested in vitro, which means in a lab, and then in vivo in a patient. Because the drugs hydroxychloroquine and Z-Pak, zithromycin, have been used extensively over the years, and they've deemed to be safe in the medical environment, uh, they're easier to use. If it was another new drug, it would be considered completely experimental, and there would have to be a lot of tests before using it, um, and making it commercially available to be used on the specific disease. So no, don't buy the chloroquine, because at the end of the day, if you have the virus, most people are going to have a very subtle symptoms, if they even progress to symptoms. I believe that the number of patients that are having the aggressive disease is going to be a lot less than we originally thought once we start the massive testing. Um, Taking blood from recovered patients of COVID-19 and injecting them into patients still suffering from it. Will that help develop a vaccine, is a question. So it won't develop a vaccine. It in itself, taking the plasma from an infected or a patient that was infected and applying it to somebody that has an active infection is kind of like a passive immunization. That's what it's called, passive immunization. Because the person that had the contact with a virus creates antibodies and fights the infection and learns to fight the infection, what you do is you extract those antibodies and then apply them to somebody that hasn't created those defenses or antibodies. You're passively immune, making them resistant to the virus. Will it help fight the disease? Definitely, because, well, as the virus replicates, those antibodies immediately adhere to the virus itself and destroy it. And that could give the body the ability to recognize or use all the different defenses and not unstabilize that person and result in a more aggressive disease. So that's called passive immunization. And in fact, here in California, one of the laboratories is looking, instead of a vaccine, they're looking at passive immunization. That is basically those antibodies that can be injected in somebody, like healthcare workers and people that are out and about reestablishing the economy. And that'll protect them several months from the infection while the vaccine, the final vaccine, is designed. So another question is, does COVID-19 make previous weight loss surgery patients at higher risk? No, in fact, if you just had surgery, yes, you have a higher risk for any type of infection because your immune response is decreased. Any type of surgery can do that, even if it's elective surgery. For all my patients out there, stay home, stay safe, look at all the guidelines we've always published. Keep yourself, nothing comes in, nothing goes out from your home. Now, having said that, do previous weight loss surgery patients fare worse or better after COVID 19? In fact, we know because we follow all our patients and statistics. And when we do weight loss surgery, it takes several weeks, but it's beautiful that the body reacts to weight loss surgery with reversal of most of the metabolic ailments, including excess weight, fatty liver, higher blood sugars, higher blood pressure, insulin. Insulin is extremely important. And all these things, the as they revert, your risk of severe disease decreases. So everybody that's had weight loss surgery with us, go ahead and party, but stay at home, because the less metabolic disease you have, the less risk you have of having a severe disease with a terrible outcome. Fewer cases in California than New York. Is that because the warmer weather? How does the temperature affect COVID-19? Well, I'm here in San Diego and there's been no warmer weather. So the theory goes, it seems that COVID-19 had a direct uh, infection, the European infection, that spread very aggressively. And there's studies that, or investigators that are looking at what virus strain we have here in the West Coast. It would seem we have the original Chinese strain over here on the West Coast, as we have so many visiting people from China, including Disneyland, right? So we have a direct flight in Tijuana from China as well. So it seems that the West Coast got a direct uh, virus strain from China, while it looks like New York may have gotten the strain from Europe. Having said that, there's a lot of studies to be done. In fact, the university here in California is doing studies on testing population because they want to actually look at the possibility or the theory that California was infected before New York. In other words, the infection came into California, maybe hundreds or thousands of asymptomatic cases developed, and this is why it could be spreading less rapidly. And last but not least, it seems that we took action very quickly after we started seeing the community spread. And of course, social distancing works. Now, having said that, there's several cases where they're reporting now of people completely under quarantine that then develop the disease. So when I tell you, be careful, nothing goes out and nothing comes in. Nobody goes out. Nothing comes in. Nothing goes out. What I'm trying to say is people will transmit the disease, but objects can transmit the disease. So be very wary. I've got a lot of videos posted online as well on how to prevent that, how to make a barrier between the outside and the inside of your house, and how you bring in the mail, how you bring in the boxes, how you bring in your grocery shopping, etc. What you do to your shoes, what you do to your clothing, how you protect yourself wearing a face mask, glasses, gloves, how you disinfect all this stuff. There's a lot to learn about this. And for the time being, as long as there's no treatment or vaccine, we're going to have to do this on a daily basis. Then there's another question. What are the thoughts on permanent immunity? I have seen that it is reinfecting people in China. Okay, so that has to be seen with caution, because if you're getting reinfected, it's either because the virus is so aggressively mutating that your body can't pinpoint the exact name and address of the virus, and that's why you get it again. AIDS is one example. No vaccine for that. On the other hand, influenza vaccines, you see that the most uh, prevalent strains in that season are stuck into the vaccine, and that's what is used. In this case, it seems that this virus doesn't aggressively mutate to a point, and it seems that you will be resistant. And I use seems cautiously because this is the information we have that we can emit an opinion on. It looks like what we're seeing more than reinfection is a reactivating of the disease itself. That's what we're seeing. That's what we hope it is, because that wouldn't be good news. Because if now we have several strains, and that's going to prevent us from creating, or prevent the scientists from preventing, a very effective vaccination. And then I've got the one I love the most is like, so pro or cons for vaccination. Pros for vaccination, everybody knows. You get a vaccine, you get to go out. Cons for vaccinations, I don't know. I've never had issues with vaccination, and this is going to be COVID-19 is a game changer. I don't think a lot of people are going to be willing to not get themselves vaccinated for a disease that could be potentially deadly. All right. And then there's another one. I heard that report the problem with COVID 19 is that the red blood cells aren't able to carry the oxygen properly. So the lungs aren't heavily affected. The patients still have trouble getting enough oxygen. Are there different strains, or is it just different ways the virus affects people? So the virus attacks the body responds with an aggressive attack. But some people have too much an aggressive attack, and that attack also hurts their own body. That's called the immune response. That's called the cytokine storm. Extreme inflammation, and that extreme inflammation, you know what inflammation can do. Hit yourself in your finger, it gets inflamed, it gets swollen. The lungs get swollen, the lungs get ingurgitated, they get a solid mass of seepage inside, and they can't work. So you can imagine something that's creating havoc in your transport system, which is the red blood cells, but at the same time, at the place where you receive the oxygen from the outside, which is the um, lungs, and that's where the red blood cells form a line, and they've got their little buckets of oxygen, and they're asking for oxygen in the alveoli, those little spaces where air and oxygen comes in. Well, if those are flooded, and then the red blood cells don't have any buckets, how do you transport oxygen? That's why when somebody has a severe disease, they basically asphyxiate. Not all the time, though. Now we've seen neurological attack, brain, renal attack, liver attack, etc. So it's an aggressive bug. It's bad. So I heard that in humid and windy weather, that the droplets could travel farther and potentially infect farther than 6 feet. What is the opinion? Yes, they can, of course. Um, Being at the right time in the right place can get you infected. So don't be there. Keep away from people that are not wearing masks. Don't socialize right now. We don't know. Again, the biggest threat is people that don't know that they're infected and may never know. And it's not until we have massive testing we'll be able to know. So those people that you have in your home, keep them at home. No social interaction whatsoever until we can uh, have that testing and prevent transmission. Asymptomatic transmission is the ones that we're mostly scared of. Let's see how we're in time. One more minute. We're going to do this one more minute. These are going to be half an hour sessions. I don't know, Gloria, do we have any questions? Let's see. Ah, Gabriela Miranda, she's on. I can't believe it. Unmute. Gabby. Gabby.
Yeah, I'm figuring this out. I'm not an expert yet. How are you?
This is awesome. What a privilege and honor to have you with us.
Oh, an honor to be with you.
This is going to be extended because, well, you need more lighting in your face. Okay. Dr. Gabby Miranda is a nutritionist. She's treated thousands of patients when we collaborated at the original Obesity Control Center. And now I see she has issues with, I don't know if it's with a keto diet, if it's with restricting carbs, but let's talk a little bit about carbs. And first of all, how you doing?
Fine. I was just doing some homework right now because, you know, I'm taking another master's degree program, getting my nurse practitioner here in the States. So I was doing a little bit of research on, you know, final projects and stuff. But yeah, things have been a little stressful for everybody because of the COVID-19. Definitely lots of word of mouth. This is going to work. No, this is not going to work. What do you think about this? What do you think about that? But I really enjoyed your videos on teaching patients how to be basically preventing the virus transmission from just a simple grocery delivery. That is amazing. Also, you've been telling patients, and I love it, eat healthy. Stay away from junk food. If you're going to be exposed with your immune system being your only thing to battle right now, let's make the best of it.
Wonderful. I agree totally. And that's what we're doing. I hope a lot of people watch this. But let me share my screen. You're probably going to be able to see my screen as well. There you go. So how do you explain this? When I was a kid, I didn't even know what diabetes was. When I was studying, you could see that there were like 2 or 3 cases in the pediatric age of diabetes, and people were like, "Oh my God, that is so strange." But we took it for something extremely rare, and now suddenly, if you look at the prevalence of obesity, it's around 52% in the United States.
Yes, remember diabetes now became a public health problem. And remember when it started being a pediatric disease, can you hear me okay? Or is there a lot of echo?
Sure.
Okay, when it started being a pediatric problem, pediatricians didn't really know how to treat diabetes, especially when it was caused by obesity. So that was another challenge for the endocrinological doctors with the pediatricians, because that was a thing that was not known. Remember also, sugar companies have a lot of power. They have a lot of power. I can't believe right now, to the date, if you're in the WIC program, you will get, and I'm going to get killed because I'm saying, you get juice. That's part of the nutrition that they get, not because the nutritionists there like it, and they just tell the mothers of the WIC, of the children that are on WIC, you can only have this much of juice diluted with water, because they don't like having juice in the meal plan. But you know, politics and economical powers and all that struggle has made sugar accessible to everybody at a cheap price. And there's
all right. And let me tell you, this guy, everybody, you can love or hate somebody, and this is the guy that I consider a mass murderer. So this guy, his name is Ansel Keys, a physiologist. He was on the cover of Time magazine, and this guy thought that he could prove that by eating fat, you would have coronary heart disease. So that was the diet heart hypothesis, right? So he was the one that started with all the saturated fat, and that's going to clog up your arteries like if it was a drain under your sink. So what he did is he looked at countries, and what he was looking in countries is deaths due to cardiac disease. You can see it right here, right? And
one second.
oh, your glasses. And what he found was that Japan, Italy, England, Australia, Canada, USA, and these countries, 6 countries, and he basically created 2 groups, and he saw that even if you were younger, sooner or later you would have heart disease the more saturated fat you would eat. So, and it was a percentage of how much energy was derived from fat during the day. So say, for instance, is half of your food energy during a day, if you ate 2,000 calories, 1,000 calories came from fat, you would die from heart attacks. So he published this in 1953, and he said, yes, I've proven it. People that eat more saturated fat are going to have heart disease. Now, if I were to ask people online, they would agree with me that yes, everybody agrees that if you eat more saturated fat, you're going to die from a heart attack. But 3 years later, 4 years later, these guys did a 22-country essay. This guy only had available all this data for 22 countries, but he only used the 6. Why? Because it agreed with his theory. Talk about somebody faking it. And what they found in the 22-country study is nothing. They couldn't find a correlation between eating fat, saturated fat, and heart disease. So even though they couldn't, this guy, Ansel Keys, became the sponsor of this guy. So what do you think of this pyramid?
Understand that like that pyramid, 6 portions of the base, when I used that pyramid back in the days, I would not let anybody go over the 6 portions of grains. That would be the total of three cups of lentils or 3 cups of beans. 11 portions, it was in my, and this doesn't count, my personal opinion doesn't count, but it was way too much. So like a person that has the weight that they want to and are in a healthy weight, I would limit it to 4 portions. However, remember, it's not about it. This is the thing. You're not it. Okay, there's something like there's refined sugar, and that's a killer. And there's also things that gives us, that nature gives us to us. In fact, the first clinical trial is in the Bible on Daniel's book, the Daniel's diet. Do you remember that one? And
yeah.
The Daniel
no
diet.
Pesticides, no herbicides, no fungicides, no chemical fertilizers, no plastic.
Exactly. So, and it's things that came from the earth. So like I have right here, my walnuts, good fats. I always have these as snacks. In my house, we eat bananas, mangoes. We also have ginger. And something that's in my husband's culture for years has been something that Lucia likes to do a lot. I don't know if you can see it. Basically it's the vegetables and vinegar. You know that Lucia.
Oh, nice.
So we add that to a lot of our stuff just to give it some, or as a snack. So the thing is, stay away, in my opinion, stay away from processed food. I don't like to demonize beans or apples or lentils. Like I said, even in the blue zones, they live up to 100 years. They have one blue zone here in Loma Linda. They're basically on a plant diet. But it's the things that are processed that I think are the ones that you should be running away from. What happens now to beef? Well, how is the cattle treated?
Let me show you this study. This study was done between 2009 and 2016. It was published in 2018. And they were looking at waist circumference, your waist size, your glucose, which is blood sugar, your blood pressure, your triglycerides, your cholesterol, and not taking medications. You know what the results were? This is the United States adult population. 12% of the US population is in optimal health. How can you explain that with sugar? I don't think you can explain that with sugar. So I think it goes deeper than that. And this analysis that I'm trying to present right now, I mean, we can go days with talking about this topic. I'm going to show you this Oh, did you guys did I actually? Oh, you didn't see this study. I was just talking, right? Here we go. Let's do it again. Nope, right there. There we go. You didn't see the slide, the past one, did you? There we go. Waist circumference, glucose, blood pressure, blood sugar, triglycerides, cholesterol, and not taking any medications. 2009, 2016, they studied the population and they found out that 12.2% of the US population is metabolically fit. That means that 9 out of 10 people are metabolically ailing. What does that really mean? It means that half of the US population has diabetes. All right. So why do I say that half have diabetes? Because 49 to, yeah, pre-diabetes is like being kind of pregnant, honey. I'm going to ask you, my favorite genes are a company that uses every 3 years, what they do is they increase the number. I mean, they increase the size of the genes, but they don't increase the number. That's the best-selling genes in the world right now in the United States. Why? Because with that company, you're always going to be a 32 or a 34 or whatever your size is. Why? Because they keep on increasing the size of the gene, but the number stays the same. So what I'm trying to say with this is when you look at the US population, the tests we use are flawed. We're looking for a symptom, which is called, let me show you a graph. There you go. Let's see this guy. This is the graph of diabetes. And I'm going to go pretty slow right here. And I want to, this is the day 0 is when you find out that you have high blood sugar, right? So your blood sugar is this green line. Your blood sugar is this blue line, and this green line is the test. See how they slowly start elevating from right here, pre-diabetes. So you're looking for a symptom, which is high blood sugar. But look at the insulin secretion and the insulin resistance. 10 years before you get high blood sugar, you have insulin resistance. And see that's when you should be diagnosing diabetes. But we're using the wrong measurement. We're using sugar as the measurement. If you were to look at insulin, look what happens. You would diagnose it 10 years before. And you know what else? You would prevent in the pre-diabetes phase, microvascular and macrovascular disease. That's what you would prevent. This is why we believe that the testing that is used should be an insulin assay, like Kraft decided to present his insulin assay in the 1975, and it's still not used extensively. And you would prevent microvascular and macrovascular disease. What does that mean? You would prevent heart attacks. You would prevent strokes. You would prevent renal disease. This is the true nature of diabetes. Diabetes is not a disease of high blood sugar because a lot of people have normal blood sugar, but most people have high insulin. So what do you think of that graph?
Look, all of this is very impressive. We know that exists. Now, I just did an evidence-based practice work. What are we going to do with patients that have diabetes? Okay, the system is not meant to prevent. There's not enough access to health here in the States. We know that. I've known that. I'm living through that right now. Now, evidence-based practice says just by having, for example, in the rural areas in San Diego, Jamul or whatever, just having a nurse go to the patient's home or get them in the center where they all meet and start talking about diabetes, start teaching them about this, how to eat, how to move. Oh my God, blood sugars would start dropping. However, something so simple is not happening. The system is not meant to prevent. The system is made to make some profit out of giving you more insulin. And right now, the problem is with patients that are paying insulin is they're rationalizing it. So how are we gonna surpass this if we haven't even start by educating the population properly?
You know why? You know what I believe? I believe even though we try to educate them, we're educating them wrong. And I'll show you why. Let me show you this. You probably are familiar with the Look Ahead trial. NIH canceled 5,000 overweight and diabetic patients. They gave them low-fat diet, low-calorie diet, and increased exercise. Move more, eat less. What happened? It was canceled. It didn't work. People kept on dying. How about this one? Low-fat dietary pattern and risk of cardiovascular disease. Less calories, less fat, more exercise. No benefit. How about this one? Higher carb. Let's study higher carb diets, like everything everybody uses. What? They found out that you're going to develop diabetes. How about this one? Higher carb, higher risk of cardiovascular disease. Diabetes and diabetes in situ, which means high insulin with normal blood sugars, equals cardiovascular disease. I believe that there is no difference between cardiovascular disease and somebody who's diabetic. How about this? The more blood sugar, the more sugar you eat, the more carbs you eat. I'm going to forget about sugar right now, refined sugar. The more carbs you eat, the more probability you're going to get diabetes. The more insulin you produce, the more insulin resistance you're going to have. There's another study. How about this one? Sensitivity to insulin. It's interesting that we look at the Mediterranean diet that has less carbs and more fat. There's a less risk than the standard American diet of producing diabetes. How about this one? Reduction in the...
However, with the Mediterranean diet, every time in nutrition, we used to see if it was applicable here in the Western country, it didn't work because it also had to do with the lifestyle that they have. The stress they have, they take their naps. They're not just going run. People here are sometimes worried about they don't have access to healthy food either. There's a lot. Can you believe there's food deserts in the city of San Diego? There are food deserts in the city of San Diego. There's no access and a walkable place to get fruits and vegetables. I know you're not about fruits. I still two to three pieces of fruit I think is not going to kill anybody. Has a lot of fiber, vitamin C. But let's say spinach. I eat tons of spinach a day because I do my smoothie. But I personally lived it. We did the research during our public community health class. There are still some food deserts. How are we going to get through this if there's food deserts in San Diego? And San Diego is one of the healthiest cities that there is, and one of the healthiest states.
I wanted to show off these slides because there's science behind reviewing history. In the past 30 years, before 2000, after that beautiful food pyramid, women and men increased their total carb consumption and lowered their total fat consumption. Okay? And never again has a study ever been able to prove that eating fat causes heart problems. This is almost 30 years of studies. Never again has it been proven. These are the things that a low carb versus a low fat diet is going to do. If you eat low carb, low fat, which is what everybody's afraid of, there's two biomarkers that are going to get better. All right. If you go low fat, your cholesterol, total cholesterol is going to get better, and your HDL, your LDL is going to get better. Your bad cholesterol. That's it. Now, do we understand what cholesterol is apart from being essential to life? No, we're stupid. Now I agree with you. Medical industry, they profit from us having high cholesterol. But look at what happens when you go low carb and high fat. Your body mass gets better, which means that you lose weight. Your good cholesterol increases significantly. Your triglycerides decrease significantly, your blood pressure decreases significantly, and your blood sugars decrease significantly. I'd rather be in this area than just getting a low cholesterol score.
Oh, for sure. Definitely.
But this is the biggest killer of them all. This is called the PURE study. Are you familiar with it?
I've heard it, yeah, before.
All right. So the PURE study, they looked at 18 countries, an unbiased from the general population, 135,000 people, and they between the ages of 35 and 70 years without cardiovascular disease at baseline. They didn't have cardiovascular disease. And what they did is this was in 18 countries all around the world. So they looked at them for followed these people for 7.4 years. And what did they look at? These are 18 countries in 5 continents. And they looked at the relation between fat and carbohydrate intake. In other words, what were they eating and what was going to happen to them? I could have said that easier. And this is what happened to them. They looked at major cardiovascular disease and mortality. This is a beautiful study because it includes all people of all races of all the world. I mean, it's a great study. And from a nutrient standpoint, the carb eaters, the more carbs they ate, the more cardiovascular disease they had. Carbs, not sugar. And mortality, the more carbs they ate, the sooner they would die. Now, if you look at the total fat percentage, people that ate more fat lived a longer life, didn't die during the study, and people that ate more fat had less cardiovascular disease. And it was exponential. The more fat you eat, the more protective it is. So that's a great study because even the fake media once in a while is going to get it right, right? Now 2014, now butter is good. So this is why, again, I'm not only talking about our research, tens of thousands of patients at this point, over 7,000 patients, that we've used a modified diet where we diminish the carb load and we let the pancreas rest. The key is insulin. It's not blood sugar. The key is insulin. The more you stimulate the pancreas, the more probabilities you promote insulin resistance by simply insulin restriction. This guy is Andreas Enfalt. He's the guy that started Diet Doctor. And these are 2 really good looking guys. That's Robert Sywes also. And fat is back, and fat is back with a bang. And by the way, this guy, Dave Feldman, he's the walking multi-perforated filtration device because he's tested himself hundreds of times and he's researched cholesterol like very few investigators are. And by the way, this guy's a programmer. He's not even a physician. So anyways, going back to, I believe I want to, 152, we're almost out of time. I'm so glad you jumped in the call. Let's do this often. I want to debate
right now because I mean, I'm so into the public health nursing right now. Oh my God, there's so much we can talk about. Because one thing is theories, other is like how are we going to get the patients to do that? How, if we still have food deserts?
Well, at least you want to start. You want to start by telling them that, yes, in this world of food, where in the 1950s we were told fat was bad, you stopped eating fat. If you stop eating fat, what do you change it to? You got to substitute it with something. Everybody eats carbs. In the 1960s, that's when we were fed this lie. Fast forward to 2020, what has industry done? Whatever the client wants. What have they done? They've created massive amounts of foods with cheap grains. And that's what everybody eats. Now you say fruits. Yes, but fruits have what? What type of sugar?
Fructose.
Yeah, and where is that processed?
Yes, but it comes with its antidote. The antidote is the fiber.
Yes. But the fiber is not going to cure metabolic disease. You're feeding 9 out of 10 people that have metabolic disease with a product that can only be processed in a fatty liver that's already under duress.
I understand. For example, right now, I got my organic beef grass-fed and did it with zucchini noodles. I personally don't eat pasta because it has no nutritional value. That's something I do it. You know, I substitute it with zucchini noodles. But when you say no carbs, wait. Like I said, there are populations that they have a plant-based diet or that eat very little protein, like the blue zone that's in Greece, and yet they're very longevic because they do not eat food that is that comes in a box. It all comes from nature. They eat blueberries, raspberries, you name it, peaches, whatever fruit. They have a lot of, and when we say a lot, it means a cup. It doesn't mean a bowl, because that's the thing. You eat a lot of carbs. Well, maybe a patient that's 300 pounds, a lot of carbs for them is because they ate, you know, their dinner bowl of pasta. For you and I, maybe it's going to be because we ate 2 cups. That's a lot. So we have to be a little careful with the type of words we use, because everybody can interpret them a little bit different.
I totally agree. And that's why I look forward to doing this on a weekly basis, because yes, I understand your point of view, but it would have to be a perfect world. And we're not in this perfect world. Right now, we're in the worst type of environment because you can't go out. You're going to get bored. You're going to get stressed. You're going to worry because the financial thing is terrible. You're not going to have the best selection of foods. And even if you do, which nobody does, you're going to select the wrong stuff, soothing stuff, stuff that makes you feel good, right? Brings back memories.
And remember, you eat sugar.
You're going to drink alcohol. You're not going to exercise because you don't have a gym. So what the hell's happening? We're all getting metabolic disease.
It takes a lot. It takes a lot. But I have here my exercise machine. You can barely see it. I have my bands, my things. You have to commit. It's a commitment every day. I used to tell patients, do you brush your teeth every day? Yes. Well, commit to exercising 45 minutes a day, just so you can get your blood pressure and a little bit better, and you can get your oxygenation on all your organs. It's tough. I still learn every day. I learn more, and it's the more I learn, the more I say, this is messed up. This is something else. And right now with the vaping, that's another thing. Yeah, people are not consuming tobacco anymore, but there's a new thing called vaping.
And you remember that they were blaming vaping for the virus deaths and stuff like that. Yeah, there's so much to learn. But anyways, you're great, Dr. Miranda. It's always a pleasure to talk to you. I think I would love to have you as an invited guest once in a while to discuss these things. I do believe we're at a disadvantage, just like you said, simply because our main food source is extremely high in carbs. We've been recommended to eat 50 up to 70% carbs during the day. Most of our carbs come from grains. Most of our grains are genetically modified specifically to be sprayed with Roundup. And Roundup, the weed killer glyphosate, is completely linked to obesity, diabetes, cancer, multiple sclerosis, Parkinson's, Alzheimer's, ADHD, autism. There's studies out there, 2013, Entropy, Stephanie Seneff, Anthony Samsel. That's a great study, how the process of using a weed killer is going to interfere with your gut bacteria, and then your gut bacteria, which is a microbiome, which is a living organism within a living organism, is interrupted, and suddenly all those normal processes that were happening inside your gut are completely stopped because 90% of the food we eat has glyphosate in it, not to mention other pesticides, other herbicides, fungicides, chemical fertilizers, the plastics that are in touch with our food, with the water we drink.
Go back to the good bacteria that's in your intestine. Now they've discovered the importance of a vaginal birth and the importance of breastfeeding on a child, because that helps the child to start their normal gut bacteria. Sometimes that's even interrupted since birth because they deliver a C-section and the mother will not breastfeed because she has to work. She's not, her environment does not allow her to breastfeed. And sometimes we get interrupted since childhood with that process. Add the weed killer to that.
There's a lot of science behind that. And you know what? It's going back to basics. It's going back to nature. I'm redneck today because yesterday I was in the garden. I was doing this huge trellis and then a vertical garden, and just placed it, and now I've got all my vegetable garden and a lot of stuff that's going to be growing, and just going back to basics. What I'm going to be sure is that my vegetables are completely virus free because nobody handled them in the grocery store. And number two, they're completely organic. Why? Because I don't put anything on them. I just water them and let the sun shine on them, and then they grow. You know what? Uh, I appreciate it. I'm glad you're into studying constantly and improving what you've already learned over the years, and we still learn a lot of stuff. But Dr. Miranda, we want to invite you for the next meeting, and let's talk about a specific topic. I definitely want to talk about a little bit about going low carb and the impact it has on the metabolism. I I see your posts and I understand what you're trying to say. There's two things. There's certain things you can't remove that have such a difficulty to put in place because of the way the system is built. And the other thing is that most people that are doing keto, they're doing it wrong. They don't really understand what keto is. So you're intoxicating your body and you're asking your body to do a lot of stuff while you're still the idea is to remove the carb load and let your pancreas rest, eat a good amount of protein, the normal amount, the acceptable amount, increase your fat to around 50%. Good fats, there's obviously bad fats manufactured. If you're going to eat animal fats, your animals should be healthy. Just what you said, organic meat, organic poultry, or sometimes the food we eat is as sick as we are, and then we don't expect to get the disease. Of course, it's the same disease, the same mediators. But that's what I want to talk to you on the following episodes. So hopefully you can join us in the future.
Take care, Dr. Ortiz. Love you all. Miss you.
All right. Thank you all for watching. Stay tuned for more information after this podcast on our posts on where you can find the future upcoming events. Thank you all for watching, and stay home, please, and stay safe.